Hi, my name is Laura Youngman. I'm an advanced practice provider here at St. Francis Medical Center in Peoria, Illinois. I'm a very proud alumni of St. Francis Medical Center College of Nursing. I've received my bachelor's in nursing, my master's, and my doctorate in nursing practice, all from the College of Nursing. When I was considering going back for my DNP degree, I actually looked at other programs because there was a part of me that thought maybe I should pursue a different school for that last degree. And when I looked into other programs, one of the things I noticed was different was I did not feel like they knew me as an individual. And when I reached out to the College of Nursing, I was immediately reminded of why I had stayed there for my other 2 degrees, because the College of Nursing is not just a program, it's a family. They get to know you, they get to know your family in a lot of ways, and you as a person, and they really feel like they treat you like an individual and not just a number, not just a statistic. You feel that they want you to succeed, and they provide that individualized support to make sure you succeed. And I really did not feel that type of relationship from the other programs I had reached out to, even just for information. I felt more like just another number, just another potential student, and whereas the College of Nursing reached back and said, we would love to have you, and made me feel very, very welcome. Working on the doctorate program is a little different than a lot of other programs. The doctorate program is a 3-year study where each course builds upon itself. So early on, you focus on a lot of research to try and determine and narrow down your topic of interest. So you really do hours and hours of research on various topics so that you can narrow your focus and decide what you want to do your project on. I was very fortunate to choose a topic that I'm very passionate about. That topic is advanced care planning, and I was able to narrow it down to a focus on skilled nursing facility education. So over the about a year, I did a lot of research that I was then able to tie into the other courses the following year. The second semester, I believe, we had a combined leadership course that I really, really enjoyed because it included not just those of us who were clinical and working in nursing clinically, but also others in the leadership track. So some of my peers were director of nursings at other hospital systems, not only in Illinois, but in other states. Some of my classmates were critical care nurses, just a variety of students. So we learned well from each other. It allowed me the opportunity to hear not only how we do things here at St. Francis Medical Center, but also how we do things in other parts of the state and other states. It was a really good learning opportunity. It forced me to learn to think outside the box and to pay attention to the research even that's out there and why other things are tried at different areas. And it was very, very helpful, and it allowed me to develop ongoing relationships with those in leadership all across, not just again in Illinois, but across the country. And I still have those as fellow friends and peers that I can reach out to say, hey, how do you do this at your hospital system? I'm currently relocating to Tennessee with my husband, and I would not be able to have accepted the position I have there had it not been for the education I've gotten at the College of Nursing. The knowledge I've gained, along with the degrees I've earned, have afforded me the ability to pursue another advanced practice role in the Tennessee area. And I'm very grateful to be able to do that thanks to the College of Nursing and all the education I gained there. Oftentimes, nurses who are considering going back to school come to me and ask, how did you do it? How did you find the time to do it? Nursing is a busy profession. We work long hours. How did you find the time to do it and go back to school? And I usually have the same response for all of them. You can do anything you want if you want it. And you can do anything you desire if you're willing to work hard to earn that. And I think I'm a great example of that because my current role is that of a advanced practice provider supervisor. I see patients full-time, all while supervising 9 other advanced practice providers. I also, while I was pursuing my doctorate degree, saw some hospice patients on the weekend in addition to my full-time position. My current full-time position, I work probably an average of 60 to 70 hours a weekend. So juggling clinical hours and coursework on top of that was definitely not easy, but it was something I had to prioritize. And I think you can succeed as long as you stay organized and you decide what are your priorities at this point in time. Often maybe I didn't get to watch a movie or a TV show that some of my friends were into, but I was able to tape those to watch over breaks and things. And this being holiday season reminds me of all the Hallmark movies that I maybe didn't get to watch early on, but I taped them and watched them over Christmas break. And so it's all about time management, staying organized, and remembering that it's just a short time. You know, you can give up a few TV shows for a short time because they'll still be there in the future. And that opportunity to pursue additional education may not always be there because you may not always have the energy to do it. So you have to do those things while you feel that you can do that. But it's very doable. Even with a busy work schedule and a busy family. I'm married, I have 2 children, I'm involved in their lives as well, even though they're young adults now. I'm involved in my church, I'm involved in some social activities like St. Jude Run, and I was able to continue doing all of those things while pursuing all 3 of my degrees at the College of Nursing. To those of you who have watched this video today, I just want to say thank you. Thank you for considering higher education. Thank you for considering the St. Francis Medical Center College of Nursing. As I mentioned, it is, in my opinion, the best nursing school in Illinois, and if not the surrounding area. I think you would be very, very blessed to be a student there. Thank you for taking the time to hear our stories and to hear why we feel this should be the college you choose.